Hello everyone, myself Rasheedha, working as an assistant professor, senior grade in the Department of Biomedical Engineering at Sri Ramakrishna Engineering College, Coimbatore. I am standing in front of you to deliver an interesting and a simple topic which has been used in many of the biomedical applications. Let's go with that. We are going to discuss a topic on thermal imaging in biomedical applications. Let's start here. So, in this content delivery, these are all the contents we are going to have, like your introduction about the thermal imaging and how it works in medicine and what are all the advantages on thermal imaging, especially with biomedical applications, and also what are the areas which has been widely used with the limitations. Let's go with the introduction part. So, what is the image we have been seeing here? We have two images, one on the left and right. So, this is the normal image where you can see the skin color, texture, or if you have any wounds you can able to see here. But what about the blood circulation and also the heat patterns? You can able to see with the right side image, which is nothing but your thermal imaging. And if you take thermal imaging, it is a technology that captures infrared radiation emitted by objects and converts it into visible images. Unlike normal cameras, it works in complete darkness since all objects emitted heat. Here the tissues will also emit heat. The brightness or color in a thermal image represents the temperature variations across the surface, what you have been seeing in the image on your right. It is widely used in medicine, surveillance, firefighting and industrial inspections. Thermal cameras help to detect faults, monitor human body temperature and enhance safety. Overall, thermal imaging provides a non-contact, real-time method of visualizing heat patterns. And in continuation with the introduction, we are going to see what is meant by thermal imaging. It is nothing but a technique which allows you to see the heat patterns, what you are seeing in the image right now. And it is being captured by the high resolution infrared cameras and they are converted into visible images of color coded, and that is being described as your thermogram. In the image, you can able to see different temperature conditions on skin types. So, this thermal imaging has a wide application in detecting the diabetic foot ulcers also, and this is an example of that. And how it works in medicine, though it has applications in all other areas other than medicine also. You know, human tissues also emit natural IR radiations, and this thermal camera captures this invisible infrared radiation and it converts the temperature differences into color coded images called as your thermogram. And the warm areas being indicated by red, yellow or the white color, whereas the cool areas being indicated by blue and purple color, and the warm areas which has the unusual hotspots being termed as your inflammation, tumors or infections, and the unusual cold spots may be like you have the poor blood circulation, nerve damage, etc. If you take in medicine, thermal images work by detecting infrared radiations emitted from the human body, and the blood flow and the metabolic activity affects the skin temperature. Thermal cameras can make subtle temperature variations on the body surface. These thermal maps help to identify the inflammation, infections, circulatory issues or the abnormal growth like tumors, which is being indicated with the differentiation in the color codes as we are seeing in the image. This technique is non-invasive, painless, and it does not require any kind of radiation as we mentioned earlier. It has been often used for breath screening also and mass detections like fever detections. The advantages are it is non-invasive. Yes, it does not require any kind of invasive procedure and it is radiation free. That's why it is called as the safest procedure. Because in CT and X-ray you will be subjected to radiation. Here this is a radiation free procedure, and it is a real time monitoring. That is very, very important because it monitors the blood flow, circulation and your metabolic activity and the pathological changes too. And The main and the unique advantage of using this thermogram is the earlier detection. Yes, due to the temperature variation, you are seeing the color coded images here, and from that you can able to detect the inflammation, tumors or any kind of skin lesions over there. And it is a cost effective method. Nowadays all the high resolution infrared cameras are cost effective. It is easy to use because it does not need any kind of complex procedure, and in mass screening capability, yes, it has been used for screening fever, and in COVID times the use of thermal imaging is a wonderful the application, because COVID-19 you should not have any kind of physical contact, but you want to screen the subject has been having some kind of COVID-19 or not. In those cases this thermal imaging played a vital role, and it is playing a vital role in mass screening also. And it is a non-invasive and painless method. It makes comfortable for the patients obviously, and it is radiation free. It can be safely used multiple times without any kind of high health risks. Yes, it is true. And early detection of abnormalities by identifying the temperature variations with inflammation, infection or tumors can also be detected here. This technology provides real-time monitoring, which is valuable in tracking blood flow, wound healing and rehabilitation progress. It is versatile, being applied in cancer screening, fever detection, vascular studies and physiotherapy. Moreover, thermal cameras are portable and cost effective, making them suitable for clinical as well as remote healthcare use. And applications in biomedicine comes under, this is the elaborative application in biomedicine, breast cancer detection. You can able to see 3 different images where you can able to see some kind of spots over here, and this spots represents the early detection whether this type, this skin, this muscle type or the tissue type will be having or being prone to have the cancer cells. So early detection for women, especially this breast cancer detection after 35 years is very, very important. But for mammograms you need some kind of low dosage X-rays, and to avoid that and to have the earlier detection, you can take this thermal images, and if you have inflammation or the unusual spots, and you can able to diagnose those sections very easily with the help of this thermograph. And you can see different kinds of spots over in 3 different images. And vascular disorders called as the peripheral arterial disease, and this actually happens in the extremities of our body, and here the leg extremity is being shown here with the right thigh and the left thigh, and you can also able to see the color variations like the red, green and the purple color, whereas if you have the unusual spots, and you can able to visualize those organs which has abnormal cell growth or the abnormal circulation and the metabolic activity inside, what has been happening inside. So for those applications in vascular disorders, thermogram plays a vital role. And neurology, of course, yes, you can able to incorporate this thermogram applications in neurology also to find the nerve disorders, Parkinson's syndrome, central nervous disorder, etc. And here are the examples for the sinus problem and also headache, migraines, etc. So those problems subjected to neurons or the neurological part can also be identified with the help of this thermogram. Sports and rehabilitation also has its in sports and rehabilitation also it has its applications, like in sports injuries may happen at any time for the sports person, and that type of injury will make kind of temperature difference certainly. In those cases it can be viewed easily, and during the rehabilitation case how the muscle muscle activators and what about the tissues inside, that can be viewed by a coach and also the experts soon. So for the recovery time also this thermogram plays a vital role in case of the sports and rehabilitation process. Limitations of thermal imaging. Though thermal imaging shows is various applications in biomedical field, this too has some kind of limitations like limited penetration depth. Yes, this only detects the surface level, the temperature changes, and it cannot provide the information about the deeper internal organs as like the conventional imaging. And it is very sensitive to environment. Environment sustainability also plays a vital role as its limitation, because it also shows a sensitivity towards temperature, humidity, etc. So it depends on the environment, and lack of specificity, it doesn't specifies the cells or some kind of an area where it has certainly inflammation, because when the environment or the situation changes, the temperature also varies in spite of the inflammation also. If they don't have inflammation also, it will be showing like the temperature change. So lack of specificity is also there. It is not a standalone diagnostic tool, since it needs some kind of good algorithms to have some kind of getting a specified outputs with the proper precision levels. And motion artifacts is also the important limitation of this thermal imaging, and the technique often lacks specificity, as similar heat patterns may appear in different conditions such as infections, inflammations or injuries, making diagnosis less precise. And thermal imaging provides limited anatomical detail compared to advanced imaging techniques like MRI and CT. We need to agree that an interpretation requires trained professionals, and in most cases it cannot be a standalone diagnostic tool, but rather than as a supportive method. Yes, it can act only as a supportive method. Though thermal imaging has several disadvantages, it is radiation free, and real time monitoring is very efficient in thermal imaging. So I request all the research persons and the students to have an interest in working with the thermal image developing algorithms. Thank you, and this is all about our thermal imaging applications in biomedical engineering. Thank you all.